great opportunity and privilege to join you at HISA 2025. I'm really sorry I can't be with you in person. Unfortunately, my commitments wouldn't allow today, but it's great nonetheless to join you and share some of our experiences from the NHS in England and the UK. My presentation was to share the context of Beyond Value, which is a strategy we've developed at Royal Papworth Hospital in Cambridge in England, and increasingly how the role of technology is about creating value, and my role as Chief Information Officer in that context as well. My name is Andrew Rains. I'm one of the Exec Directors and Chief Information Officer and Senior Information Risk Owner at Royal Papworth Hospital, and we're UK's leading heart and lung centre, and it's a great privilege, as I said, to be with you today. I've got 3 innovations I wanted to share with you, particularly through our learning here at Royal Papworth, and which I hope will be of interest. Hopefully you can see my slides as I run through those, so let me take you through those next. But thanks to Google, they've mixed me up with somebody who's a bodybuilder, which is really good when I'm in the humble place of an IT director. I wonder if he's going around saying he's been confused with an IT director. I'm not sure who's coming off worse, but anyway, that's me. Some of my experience is always good, I feel, to share some of that when you're presenting to such a prestigious conference, and all of you fantastic people there. So my background is about over 25 years in health and care IT, including overseas and private sector, but I've worked in major London acute hospital, local authority, prison service, and as I said, private sector as well. I really believe in professionalism in IT, and I was really honoured to be a fellow of the British Computer Society, but also managed to make the list for CIO UK 100 in the last 3 years, which has been a wonderful accolade and which I'm very humbled by. The NHS has a plan for the 10 years called Fit for the Future, and it sets out some targets for improving and making the NHS a more sustainable healthcare system and service. It focuses on these issues here: 3 shifts, a focus on hospital to community, analog to digital, sickness to prevention. Digital, and specifically to help productivity, reducing waiting lists and saving money. And specifically it speaks to having a digital front door to the NHS through what's called the NHS app. It speaks to artificial intelligence, a single patient record, and single sign-on, which is quite specific, but those are all things that are in the plan. So as Royal Papworth Hospital, I mentioned we're UK's centre for heart and lung surgery. There's a few aspects of delivery which make me really proud to be working for this institution. 98% of our patients would say they would recommend us to their friends and family, and in 2019 we were regarded outstanding by the CQC, which is the monitoring organisation of the organisation. So that's a great accolade indeed. There's our hospital, the blue building there on the right, and right next to it, the gold building, is the Heart and Lung Research Institute, which is the biggest institute for heart and lungs in Europe. So everybody's driving after this word, productivity, and it seems in every conversation, how do you create value, how do you do more with less or the same, and how do you strive for improvement? And I think in the context of digital transformation, it remains the same, that you have to understand really 3 things: people, process, and technology. And they come up time and time again. And don't underestimate the significance of the people aspect. Technology is sometimes the the commissioning of technology and understanding the benefits of that. But in fact, the complexity really is people. But yeah, PPT, people, process, and technology. Remember those things. At Royal Papworth, we have a digital strategy, as I suggested, called Beyond Value. It has a 6-point delivery plan, and we've called it here our Deliver It program to deliver those aspects. And they combine Secure It, which is our ICT security program. We think that if you're resilient, first of all, you've got a solid foundation on which to build your services. We do value a scheme called Scan for Safety, which is a nationally run program, and this is enabling to scan people, person, process, and place, and create an ecosystem where data is scanned and collected in systems to absolutely drive improved patient safety, better data quality, driving better outcomes. Record It, this is our EPR transition program, so moving to a new electronic patient record. We've got a shared care record as well, which enables us to grow pathways with patients, and which is really exciting. Use It is our data analytics and business intelligence program, and Innovate It is our space whereby we are looking to explore how do we get the benefits of things like robot process automation, emerging technologies, artificial intelligence. So here's the 3 initiatives and innovations I wanted to share for you. Firstly, Scan for Safety, right patient, right place, right time. And I think this is really important program for us at Royal Papworth. So why do we do this? Well, there are several stories that you'll perhaps be familiar, read in the news, which is around sometimes counterfeit drugs in supply chains. We had the horse meat scandal several years ago in the UK. There was a problem with breast implants and the materials used. And some of those things triggered the questions around, well, those all indicate excellent uses of technology where there's traceability. And probably we can do that with some of our pets, but why can't we always do that with patients? And what do we need to do to better understand the routes that patients go to gaining healthcare in a way which is auditable, traceable, effective, safe, and cost efficient? And there's some helpful papers in the NHS and from government which talk about those. First, Do No Harm, a really interesting read into the Independent Medicines and Medical Devices Safety Review, and that looks at how traceability is helping safety as well. So creating value, if we're to describe perhaps this hose as a way of using a standard fixture, they're all designed to perhaps sprinkle or to water your garden or wash your car or to clean. But the great thing about hose is perhaps this universal connector here that can connect perhaps most hoses so that they can extend or to join certain devices, whether it be a tap or perhaps a hose, a washer, a sprinkler. They've multiple uses, but they do the same thing. And it describes a really good way of open standards for interoperability. And at Royal Papworth, internally, we use a standard which we aim to join up all of these dots. This is part of the Scan for Safety initiative. So what it enables us to do is Scan for Safety uses a barcode, a global standard called GS1, which when we buy from our inventory management system and our catalogue system, we buy in and it uses a standard barcode. Now, when that product, therefore, arrives in the hospital in goods in, we can trace its lifespan through the hospital, whether it's a patient, whether it's a blood, whether it's a lab result, whether it's a drug, whether it's a medical device, whether it's a piece of equipment. The aim is that we can tag it and trace it We can even down to every single room in the hospital has an individual barcode. So that person, product, place, time is fully traceable throughout the hospital at any one time with a simple scan. Here's an illustration of the devices that we've connected, including a full ceiling reader, RFID across the hospital. Every room, as I said, is barcoded, and it means that when our patients are seen, they have a wristband which uses that same standard, so that every time we're collecting a standards-based data quality stamp, which we can then utilise in many different ways across our hospital, allowing us to gain precision data. At the end of that lifespan, it enables replenishment, it gives us sustainability because we can count better what we're using and losing. We can also use big data from that, and that will eventually give us much safer results when it comes to drugs and administrations of medicine, better safety, efficiency in our ward audits, for example. We can track and trace devices throughout the hospital and when they go outside the hospital, so preventing loss. We can track equipment in that respect. We can also understand much more closely the relationship between product and our patients and our staff. Ultimately, this gives us a way of providing a patient-level costing as well, so and service line reporting, which enables us to manage our finances at hospital much more closely. Some of the benefits, I think it's really important that we can monitor these, and here's an example. A audit which may have taken a nurse as much as half a day time, we're down to within 2 minutes. Remote care, implantable cardiology device monitoring. We're now, just before the pandemic, we're measuring something like 1,000 patients. We're now well over 5,500 patients. Lab results we're getting in real time. Medicine safety, we can demonstrate benefits in terms of avoidable incidents. Blood track uses blood to help track patients to the right blood, and we're managing to reduce our wastage from 5% to within 1%. Because of the way Scan for Safety works, and these metrics are so measurable, it does allow you to track benefits much more easily. The other next initiative I wanted to talk about was the shared care record in the UK, and this is used in lots of communities now across the country. In Cambridgeshire and Peterborough, where we've got a shared care record whereby every health and care organisation has their own set of records. And that in itself is useful perhaps to those organisations, but what about if you wanted to see information held in other systems? And the best way that we can do that is through the shared care record. So for individuals, this provides a data repository which each of those systems can put their health record data, and it allows each of those partners to see, on a strict need to know with the right access permissions, data about the care of that patient. For health and care professionals, this means less time spent seeking information, much more coordination of care. For integrated care systems, it supports care pathways across systems, cost saving through more effective way of working. And there's several examples of that, and one of them is some of the care pathways that we use, not exclusively physiotherapy and coordinating care, but end-of-life care and coordinating very sensitively visits from multidisciplinary teams that can access this record and see who's visiting, so that the care is more joined up and more seamless. Don't know if you can see that, there's a lot of data on this sheet, but just to give you an example, across the top here are all the organisations in our system that can see the records in the context of their own patient records, and that will have information like things like alerts and risks, allergies, appointments, assessment, care episodes, diagnosis, encounters, follow-up, free text, immunisations, key worker information, the list is really supportive, and our staff are often real advocates for saying how helpful this information is. To have it all in one place, they can see it in a single view across the whole system, and that's providing much more seamless care. And I think the third one I want to share with you, the third innovation is this. This is Versius, our robot, on the left-hand side here, and this is our very proud thoracics team of surgeons, and they've done some fantastic work in augmenting their team with the Versius robot. We're the first in the UK to use this robot for thoracic surgery, and it's having quite an impact, and we were really pleased how welcoming our surgeons were in terms of this new member of the team joining them and bringing our surgical practice really into a new era. What it does is means that we can provide robotic surgery with a minimal invasive approach. It uses full standards, again, interoperable, vital for connecting care. So despite different systems, the robot works and manages to collect data and provides information, including training records, to manage all types of procedures. It's really effective, and so we were first in the thoracics surgery to use it in the UK, ensuring continuous improvement in enhancing functionality. But that's been a challenge, which is how do you create capacity in the workforce? Perhaps in difficult to recruit areas, a robot may be a really advantageous work forward. And it was such a success because it was led by clinicians at the Trust, supported through my digital team, and we efficiently introduced it. It was a major impact across our teams, and the scale of it means that we've now increased the provision of robotic surgery and have rolled it out to more than 250 patients. It also gives us data back through the fantastic fine cameras at the end of the medical precision instruments, which we can learn from and do more research. But essentially what it's led to is less invasive surgery. We've got evidence to say that in some cases patients are going home as much as 2 days earlier than they would do. So that's fantastic, and it gives us continuing insights into how we can improve our surgical practice. So I hope that's helpful. What have we learned from that? Well, in this really important and growing technology age where we talk a lot about the value and benefits of artificial intelligence, governance and getting the basics right really still trumps. It's a critical factor for how you're managing your technology and your data. Data capture is vital for data quality. We talked about Scan for Safety in my presentation, and that means that unlocking the value of AI is really important, because we sometimes talk about data poisoning or AI hallucinating. Well, if you've got really good data capture and you can vouch on that data, if you're using therefore AI on top of that, then it provides you with a really good assurance layer that you're using the best data quality possible. Focus on the problem. What is it you're trying to fix? Don't fall to the fear of missing out because somebody's ahead. Focus on the problems that you're facing and look for the appropriate technological solution for that. Plan for change and use risk. Make sure you've got the right resource, engagement and funding. We talked about that within the context of our surgical robot, about how MDTs are involved in that process. Monitor the delivery and benefits, but be focused more on the value and outcome of what that enables and what that will yield. Learn, continually learn, remain humble in terms of the benefits of what you're doing, but also that a continuous improvement cycle should be in place. Resilience. I think, again, this is really important. Watch out for those schemas where maybe you've invested all your eggs in one basket. Let difference be your friend. I think increasingly with the global geopolitics, we're seeing increased cyber attacks in the UK, and that's not just the UK, but it is a factor. And therefore, how do we use the design principles of engineering to design out issues? And increasingly think about how you're creating value. How does that technology create value in your organisation and drive more than benefit when we talk about value? What are the decisions, perhaps the obvious decisions sometimes, that need to be made to actually rinse every value out of what it is you're trying to achieve? I like this phrase from Dame Fiona Caldecott. You've probably heard of the Caldecott Guardian NHS. That's a senior board level member who's responsible for patient data. And she said this: data about people's experience of health and social care has huge potential for improving service and discovering more effective treatments and ways to provide care. Those benefits will not be realised without public trust. And that is the key. That is the relationship between the consultant or the nurse and the patient, built on trust. And it's so easily lost. So in everything you do, hold that dear and at your heart. And for sure, lastly, I think AI will no doubt offer advantages for productivity, but it is vital to have an understanding of the yin and the yang, the good and the bad, and making sure, like we do at Papworth, that we have a focus on getting the basics, including a AI steering group, good governance, making sure data quality is a significant player in the successful use of artificial intelligence. Ensure clinical safety is really prevalent, and beware of the unintended consequences. Start with real problems, as I said, and make sure above all that you're not focused necessarily on the latest red balloon, but making sure that you're focused on the right solution for the right problem. I hope that's been helpful. Everybody at HISA, I'm sorry again I couldn't be there. Thank you for listening. I wish there was the opportunity for questions, but I'm sure that'd be a challenge. But perhaps another time I may be able to join you in Joburg. I'll leave it there. Thanks ever so much, and see you all again soon. I hope you enjoy the rest of the conference. Thank you.